Hi, I'm Myra Ludinger. I'm a doctor of nursing practice, board certified primary care adult gerontology nurse practitioner, and menopause specialist. Meet Sarah. She's 52 years old and came to see her doctor because her hair just isn't what it used to be. Her part is getting wider, her ponytail feels thinner, and she's finding more hair in a shower drain than ever before. She went through menopause 2 years ago and she's feeling frustrated and self conscious. If this sounds familiar, you're not alone. Hair loss affects up to half of all women at some point in their lives and becomes much more common after menopause, affecting roughly 1 in 4 women in their 50s and even more women as they get older. So, what's actually causing it and what can we do about it? Let's break it down. Hair loss in midlife women usually isn't caused by just one thing. Here are the most common reasons. Number one, female pattern hair loss. This is the most common cause. Over time, hair follicles gradually shrink, producing thinner, shorter hairs. You will typically notice a thinning across the top of your head or a widening part. The good news? Unlike men, women almost never go completely bald, thank goodness. Number two, hormonal changes during menopause. During menopause, estrogen levels drop, while male type hormones called androgens become relatively stronger. Since your hair follicles are sensitive to these hormone shifts, this imbalance can directly affect how thick and full your hair grows. Number three, telogen effluvium. It's a fancy name for stress related shedding. Sometimes a stressful event like a major illness, surgery, a crash diet, or even emotional stress can push a large number of hairs into a resting phase all at once. About 2 to 4 months later, those hairs fall out together, causing noticeable shedding. The good news is this type of hair loss, it's usually only temporary. Number four, nutritional deficiencies. Low level of iron, vitamin D, zinc, and certain B vitamins have all been linked to hair loss. And these are some of the most fixable causes. Number five, thyroid problems. Both an underactive and overactive thyroid can cause hair thinning, which is why your doctor will likely check your thyroid levels. And of course, we have other causes, certain autoimmune conditions, medications, and less common scalp conditions can also cause hair loss and should be discussed with your doctor. What blood tests should you ask for? When Sarah visited her doctor, she didn't need dozens of tests, just a few targeted ones. Here's what a good basic workup looks like. The core tests are TSH, checks your thyroid function. Ferritin measures your iron stores. This is a different from regular iron test, and it's more usually for hair loss. Vitamin D, low levels are linked to hair thinning. A CBC, a complete blood count. We're looking for anemia and overall blood health. Additional tests if needed. If you're experiencing acne, unwanted facial hair, irregular periods, your doctor may check hormone levels like testosterone and DHEAS just to look for a hormonal imbalance. One important tip, if you take biotin supplements, stop them at least 48 to 72 hours before your blood draw. Biotin can interfere with lab results and give inaccurate readings. Now, there's a lot of confusion out there, a lot of treatments, a lot of talk on social media. So, what treatments actually work? What does the science say? Minoxidil, also called Rogaine, that is the gold standard. This is the only FDA-approved treatment for female hair loss. It comes as a liquid or a foam that you apply directly to your scalp. The 5% foam applied once daily is the most popular option. It works by extending the growth phase of your hair and improving blood flow to the follicles. So it takes about 6 to 12 months, so you have to be patient. And about 15% of people notice some increased shedding in the first few weeks. Don't panic, that's normal. This is actually a sign that the treatment is working, as old hairs are being pushed out to make room for new growth. There is also a newer option, low dose oral minoxidil, taken as a small pill. Some women find this more convenient than applying a topical product daily. Your doctor can discuss whether this is right for you. Another option is spironolactone. This is a hormone blocker. This prescription medication blocks the effects of male type hormone in your hair follicles. It is especially helpful for women who have signs of hormone imbalance. It's often used in combination with minoxidil for better results. A recent study of over 400 women found that this combination was generally safe and well tolerated. It's important to talk to your healthcare provider because spironolactone can influence your hormones as well. So you need to be careful with that and talk to your healthcare provider if that's a good treatment for you. Now, other helpful treatments, low-level light therapy, special red light device you've probably seen on social media, caps or combs. They are used at home. They're FDA cleared and show some improvement of hair density, but they can be very pricey. PRP, platelet-rich plasma injections, uses your own blood processed and injected into the scalp to stimulate growth. Can help a little bit, but also can be pricey. Microneedling, tiny needles create some micro injuries in the scalp that may boost the effectiveness of topical treatments. And of course, nutritional supplements are also out there, several different brands. Some provide some studies, but usually results vary from person to person. So here is what Sarah learned and what you can take away too. Don't ignore it. The earlier you address hair loss, the better your results will be. If you're noticing some changes, make an appointment with a doctor or a dermatologist. Get the right blood work. Ask for a TSH, a ferritin, a vitamin D, and a CBC at a minimum. These simple tests can uncover treatable causes and fix what is fixable. If your iron or vitamin D is low, correcting those levels can make a real difference. Eat a balanced diet rich in protein, leafy greens, and healthy fats, and start treatment and stick with it. Whether it's minoxidil or spironolactone or both, consistency is everything. Give it at least 6 to 12 months before judging results. And be realistic but hopeful. The goal is usually to stop further loss and improve thickness, not necessarily to get back to your 20-year-old hair. But many women see meaningful improvements with the right approach. And of course, take care of your mental health too. Hair loss can take a real emotional toll. It's okay to feel upset about it, and it's okay to ask for support, whether from friends, family, or professional. Hair loss in midlife is so common, and it's not your fault, and most importantly, it's treatable. A simple set of blood tests and the right treatments can actually make a big difference for you. So talk to your doctor, be patient with the process, and know that you're not alone in this.